a very important person who's been a member, very gracious member of our executive committee, and really very generously given his time and expertise to helping us, shepherding us through this very rewarding journey, Dr. Eric Fain. I'll let you tell us your story.
Sure. So I grew up in Rhode Island, and from a young age, I had it all sort of planned out in my mind. I was going to become a doctor, and always thought that was just going to be the way that it was going to be. I moved out to California to go to medical school at Stanford, and previous to that, I had been as an undergraduate, I was an applied math major. That was another fundamental thing. I was always interested in mathematics. Originally, I was planning on being a pure math major, and in my second year, I went to my advisor and asked the question, so if I do that, what am I going to do with this information? And he just turned to me and said, go out the door and turn right and go down a few buildings and go to the applied math department, and they'll be able to to answer your questions. You'll fit in better over there. So I did that and got some exposure to algorithm development and really looking at the world through mathematics and trying to solve problems, and that was very useful to me in thinking about biological and physiologic problems as well. So when I got to medical school, I wanted to continue on doing some getting involved in research, and I was lucky enough to meet a professor there, Dr. Roger Winkle, who had about a year and a half earlier, his patient became the very first patient to get an implantable defibrillator for ventricular arrhythmias, and started doing research with him and some of the fellows there in the program. And then as I was going on, I became really more focused. I had kind of figured out I wasn't going to do private practice. What I really was going to be interested in was academic medicine. And so actually took a year off during medical school to have an AHA research fellowship year. During medical school, came back, was doing my clinical rotations, and towards the end, a company was getting formed, and I was asked to continue to do some of the basic science physiology work for that implantable defibrillator company. And when I graduated, I had gone into the match, and but I was really thinking I had just kind of ran through everything, and this company was starting, and it would be a great opportunity to get exposure to that. And so the plan was just a single year, and then I'd go back and complete my internship and residency. And I really fell in love with that side of things because it allowed me to not only focus on medicine in a different way, but also to put into practice a lot of the mathematics and engineering exposure that I had in thinking about it. And I had to make that decision about how I was going to satisfy my own interest in really being patient focused. And so rather than having my own patients and dealing directly with them on a day-to-day basis, I really looked at this as an opportunity to, while not doing that, really have an opportunity to affect a much broader population of patients if things were successful. So I decided to stay at the company and really focus in the areas in the beginning of defining the products, continuing to do research on some of the waveform work for defibrillation, and then getting involved in the basic clinical trial work that was done. And that company, I stayed there for 10 years, and we brought that product through the whole FDA approval process and onto the marketplace. And then we were acquired by a larger company, Jude Medical. And then I continued on to have responsibilities primarily in the clinical area to start with. And during that time, again, very fortunate in that I was able to continue to really be involved in more early stage research, bench and animal research, but also to really get involved in some large scale clinical trials and able to publish. And I was had a number of publications, including a couple in New England Journal associated with trials. Was able to develop a good number of patents for products and continue on it. And throughout my progression there, I took on responsibilities for not only clinical but the regulatory function, but also the R&D function for what we call the Cardiac Rhythm Management Division for St. Jude. And then as the company grew and got interested in other areas, I was able to expand my roles there, eventually becoming president of the division that had cardiac rhythm management and also our neuromodulation business. And one of the reasons for me that kind of pushed me in the direction of moving away from sort of that research and clinical and into more of the overall business management was really an interest in the overall strategy of how the business was going to be managed and run, and how things were going to be prioritized, and also really making those strategic decisions and working with the teams about how we were going to continue to evolve in the ever-changing business environment for medicine and medical devices. And that kind of took me up. You heard Jim talk about how he was involved in a number of acquisitions. Mine were spaced out a little bit longer, but we were recently acquired by Abbott at the beginning of 2017. And after sort of about a year of going through all the integration work and planning, as a lot of things go, the senior management team wasn't going to be quite the same, and so I transitioned out of there this summer. And so getting to your last question of thinking about what I would do, I'm in that situation as you will be, as well as now at this point in my life, I get to take a step back and take a break and think about what I'm going to be doing next as well.
But you're not a 30-year-old with
anxiety. No.
That's a big
There's some advantages and some disadvantages there, absolutely.
So yours was a very unusual, on many levels. You were old enough to not go to the fail-safe academic world at a time when industry was, this very distant apparition. You were very successful in industry. Now, for example, the typical data scientists, they think nothing of going to Google, spending a few years coming back. So there's a back and forth, and with industry doing a lot of things that are done in the university with a lot less regulations. But there are many nuances that are very specific to industry, and you live the life of the mind, but in a different way. And what are your first-hand insights of the good things and some of the challenging ones?
Yeah, so I think some of the good things is that, and for me it was important, is that a lot of times you can be working in research and working on projects for a long time, and you can create a body of knowledge, but you may or may not see that through to having a practical application and having an impact on a field or on patients, in my case, in a medical device business. So I think one of the real advantages and one of the things that draws scientists to companies is that promise of, or at least the opportunity to be working on something that could be significant, and then seeing that implemented in use and helping patients. I think some of the disadvantages or more challenges in an industry environment than academic is a little bit less safe. The environment can change, and programs that you're on could be eliminated, or you could be pushed off into doing something that maybe you're not purely as interested in for a time. And so there's definitely puts and takes there.
In a way, it's exciting because you do practical science, and the way industry frames value add is, can you sell it? In the university, we have the privilege of just testing a hypothesis, irrespective of whether it has a practical value to it. as long as we can solve hypothesis testing, that's good enough. So I can assume it's a very challenging.
Yeah, and we try to, and some years it's better than other years, but we try to reserve a certain amount of money to sort of these blue sky projects and just discovery, because what we've seen is that even though there may not be a directed outcome for that there are some good ideas that then will lead to things that will end up in products.
So those in the audience, that they're interested in approaching industry and working in the blue sky component of that division, how do they go about it?
Yeah, I think it's probably difficult. I think you need to really talk to the companies that you're going to interview at, if that's and really try to get a sense from the people, the level of commitment in that, if that's what you're interested in, because and usually you can kind of judge the likelihood by the size of the company. The bigger the company, the more opportunity there's going to be to have some funding to go after that. The smaller companies are going to be pretty focused and pretty directed on getting that product out as quickly as possible.
So given your unique career narrative, what are 3 things you should have done or could have done, you think, after you finished medical school and before you went to industry?
Yeah, I think one thing, and I was surprised that nobody else mentioned it, I really had, well, first of all, I didn't plan to do it until it happened, so I didn't give it too much thought, but one thing for sure is I didn't have any background or any training on finance, budgeting, those sorts of things, and I think whether you're in industry or in academics and you're trying to run a program, that's an important aspect, so I would highly recommend people get some exposure to just the basics of finance and budgeting. I think that would be helpful. I think program management, I had mentioned that's something that he falls back. I think formal program management is something that you may think about, you're organized, and you can run a program, but having that formal background, I think, would also be important. And then probably the third thing would be something on getting exposure, thinking through sort of that people management. And as much as anything else, it all comes down to people and how people can work together and help solve each other's problems and move things ahead.
So beyond being a connector, what are the other traits you saw consistently in people who did very well in industry?
I think that number one, I think is certainly integrity. I think I think on either side, academics or in industry, there's always going to be issues that come up, and seeing how people really go about that, and making sure that there are shortcuts and there are decisions that people can make that are short-term decisions, but you have to really stick to the people that are successful. Really stick to taking the long road, doing the right things, and thinking about things the right way. I think one thing is really people who are successful remain curious. They want to learn. They want to dig into problems. They want to know the details, be able to solve the problems. I think people also need to be very passionate about what they're working on. We all spend a tremendous amount of time in our work and doing something where you're not very passionate about it. You're not gonna get the most out of it for yourself or for the business or your team. And I also tell people that I work with to differentiate being passionate and being emotional. Passionate's good. Emotional can be good sometimes, but it also has its shortfalls as well.
You become roadkill very quickly. So it is obviously, it has its own set of challenges in terms of work-life balance. Is that achievable in industry? How does it compare to academia? You have a lot more flexibility and control over your time. How do you strike work-life balance in industry?
Yeah, I'm probably not a good example to hold up, so I'll put that out there to start with.
A memo to your 30-year-old self.
Yeah,
what would you say?
That would be one thing. I was lucky enough to have an understanding wife, but I do think it's harder in industry than it is in academics. And part of that is that you really don't have as much control over your time and schedule because there are so many external things that come up that sort of drive your day and your time. I was thinking about what Susan said earlier about she doesn't schedule any meetings in the morning. She can think and she carves that out. If I have, an hour a week of where I can be totally undisturbed and know it, that would be a luxury for me. So
there's always Ed where saw constituents till 5 in the evening and then
yeah.
But that was on the hill. Career paths, seeing what you know about the university of industry, are there opportunities where you see them growing? And
yeah, I think it's an interesting time. There's a lot of consolidation in most industries today, and so on the one hand, there's less companies to have opportunities with. On the other hand, sort of the breadth of portfolios that are out there continue to grow, and in a lot of ways that creates opportunities, especially like the things that are being worked on here at MD2K, because instead of having a company that's really kind of just focused in one area, you have a number of different areas that they're in. And then one of the challenges and one of the things that I think presents one of the bigger opportunities is, how do you leverage across those portfolios? How do you think about things instead of just as a product line, but really get a chance to think about disease states? And how do you manage patients? How can you best serve patients? How can you best serve the clinicians? Certainly, big data in medicine is a huge opportunity. I think that everybody's really focused, and appropriately so, I think, on personalized medicine. But I think the lower hanging fruit, and that can make a huge difference in terms of costs and improved outcomes, is consistency of care. And if we can just get everybody to take the guideline and evidence-based approaches that are known today and absolutely apply them consistently, we would see huge gains in outcomes.
Questions from the audience?
I was going to ask if you ever struggled with doing what was good for the business and then wanting to help people. Was that ever an issue?
Well, I think I'd answer it on a couple different levels. I think one of the things that for me, and I think coming from the clinical background, I was always sure to put first and foremost that whatever we did was going to be with the patient in mind and with the clinician in mind. I think on the other hand, though, when you're trying to prioritize, that's when there are a lot of struggles. There's always more great ideas than what you could do, whether it's because you don't have the people resources or you don't have the funding. And I think that's not any different than what it is for NIH or other academic institutions. But I think on the business side, you get to make those decisions on a pretty regular basis, and a lot of it is really within your control. So I think that's tough, and you can have a lot of spirited discussions about what program can be successful and how do you measure success in terms of dollars versus potential impact, and having to prioritize those is often a tough decision.
Question. What's the level of freedom you experience in industry?
I think again, it depends on the workplace. For me, it was I was in an environment where I was able to do a lot of different things. One of the things I think that allowed me to be successful was to not just focus in one particular area. And so it goes back to this depth versus breadth. And I think for me, having responsibilities and exposure to clinical, to regulatory, to R&D, to operations, to marketing, to sales, those and spending time enough in those areas to really understand them made me much more successful than I would have been. So when I talk to people, even if you know, let's say you're an electrical engineer, even if you know that's your career and that's what you're going to want to do, relatively early on, my recommendation would be to spend some time in quality, spend some time in the operations area, because, and not just that you go to some meetings, but really focus on that for some period of time, because you'll come away from that having an understanding of what those people need, the problems those people need to solve and deal with, and you'll have some empathy for them as well. When you come back, if you come back and you decide you're right, you were going to be an electrical engineer and that's the path you were going to be on, you're going to be a much stronger electrical engineer at that point.
One quick question that Dr. Abbott, is there one book or a couple of books that you think had a huge influence in helping you manage the way that you were able to manage your career?
You know, I'd have to say, I mean, I've read a number of books along the way. You know, for me, I think really the practical experience has made a bigger impact than the books. I think everybody's different. The environment you're in, you can take some principles, and I think that's true. But in terms of, at least for me, the biggest impact is learning from the people around me and how they manage, for good and for bad. I mean, I have an equal number of examples in my mind when I think about doing something, of saying, okay, I'm not going to do it that way, and I'm not going to treat people this way. I'm going to think about something else. To me, that's had the bigger impact on me.
So I alluded to one author, Malcolm Gladwell, and in particular, Tipping Point was just a great book for me to. And I think he's the way he writes, and arguably a scientific approach as well. It kind of influenced me in terms of the potential energy and that's needed in order to actually see something come to fruition. But I completely align with the comments made. One of the great things about being on the Hill, despite having a million meetings, but you also get to assess. Man, that person's job is awesome, or I would never want to do anything related to what that person is doing, or watching the interactions and kind of doing that, people watching and banking it in your head so that you can apply it later on in life.
Yeah, this is really terrific advice. I'm always fascinated by the worldly wisdom in the conversation we had this afternoon. And in all of us choose to express our humanity through the professions and career narratives we take. Nothing bad, less or more. It's just the way we express ourselves and connect with the world at large and find meaning. So all of you out there will do well. We know you all and find your own narratives. I'm hopeful that all the worldly wisdom you have from the people at the 40,000 feet view will guide you in that. And keep in mind that there is always a community of well-wishers like us behind. We actually derive a lot of satisfaction and meaning in watching our own grad students go on and do better than us. And so, you're not alone in your anxiety-filled angst and journeys. There are us behind you. I also want, on behalf of all the faculty who have come in from far away places, and I emphasize far away, I want to thank the University of Memphis. It's been a very generous supporter of this enterprise. I want to thank Santosh, of course, for hosting us, but Joe Biggers and team, it's an extraordinary amount of work that goes, all the logistical details. So Barbara, Joe, Brian, Janine, publicly express our appreciation for all the efforts that have gone, and of course to Eric and Ed all those wonderful panelists who have, hopefully some of them are on planes. It'll be embarrassing to run into them at the airport and find that, their plane never took off. But thank you so much and being with us and sharing your expertise. So a big round of applause to our